Today we're talking about total knee and total hip replacement. We all know that there's quite a recovery period from that surgery, but did you also know that there's a great way to prepare for that surgery? Bluff Medical Center has the answer, and the answer is Joint Camp. We're going to talk about that today, and we have a fantastic set of panelists who are going to tell us more. Deb Bieland is one of the staff pharmacists. She's going to talk about her role in Joint Camp. She's been with Bluff since September of 1990. Karen Patton, a physical therapist here at Bluff. She has advanced certification in vestibular rehabilitation and some training in Tai Chi as well. She's been with Bluff since 1996. Mike Wolf, who is the Director of Anesthesia Services. He has been at Bluff since September of 2013. And Andrea Thompson, who is the Perioperative Coordinator. She's been with Bluff since 2000. From the Bluff Medical Center here in Mauston, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. There is a very special program here at Bluff Medical Center called the Joint Camp, and we're going to learn a little bit more about that today. I've got a great team of panelists: Deb Bieland, Karen Patton, Mike Wolf, and Andrea Thompson. Welcome all. Good to have you with us. Thanks for hosting us here today. So obviously we're talking about the Joint Camp today, which is sort of the prerequisite to having total hip or total knee replacement here at Bluff. But let's back up a little bit. How does a person know whether or not they need total hip or total knee replacement?
Here. Well, usually the dead giveaway is pain.
Okay.
Pain, not just knee pain. I've had knee pain, Deb's had knee pain. But really knee pain or hip pain, that really is starting to interfere with your lifestyle, your activity level. For a younger person, that might mean they want to golf and they can't anymore.
Right.
The pain is, for an older person, it might mean the pain really limits me from taking care of my grandchildren, or I can't walk out and get my mail like I used to. We always try more conservative options first, including physical therapy. Sometimes that's a solution. Sometimes that just is a temporary Band-Aid, buys some time so that you can have your replacement at the right time for you, your circumstances. Might be a brace. Sometimes we look at injections. But a lot of times it might just be some education. Hey, this muscle is too strong, this one's too weak, let's balance those out and see if we get some pain control.
Okay. So you try to go through some of those solutions first, and if that doesn't work, then it's like, okay, it's time to really look at to see if we need to do a total replacement. So, Andrea, welcome. I'm going to turn to you for a second here. Give us a brief synopsis of the Bluff Joint Camp and what your role is there.
Joint Camp is where patients come to talk with multiple different disciplinaries, I guess, to discuss what happens the day of surgery, what happens the days soon following surgery, talk about healthcare power of attorney, paperwork, medications they're going to start after surgery while they're in the hospital, such as pain medications, stool softeners, anticoagulants or blood thinners. My role is simply to make sure that everything stays on time, going how it's supposed to. People are showing up on time or coming early. If people are done early, it kind of depends on how many patients we have for the day. I also give patients their day of surgery instructions, so when they need to stop eating and drinking, when to take their showers ahead of time, because we have a special Hibiclin shower that they take. And I also collect what's called a MRSA swab, and that's to check for methicillin-resistant Staph aureus, which people can carry without knowing they have it. And it's considered one of the super bugs that you hear about. And treating that ahead of time helps prevent major infection in their freshly new joint.
Yeah, absolutely. That's important. So you're coordinating a lot of that stuff, it sounds like. Karen, what about you? You're the physical therapist of the group. What is your role within the Bluff Joint Camp?
I'm called the drill sergeant. I'm the one that says, here's what to expect. PT has 3 roles: exercise, education, and mobility. So they know they're going to see me that afternoon. They're going to see me and say it's time to get up when they really feel like, oh, can't I lay in bed another day?
Yeah.
And then education on the exercises and what to expect, and hopefully, ideally, getting someone and their coach. We like to have their coach come with them, starting those exercises so they are really routine and they know what to expect.
Excellent. And Mike, you are our certified registered nurse anesthetist.
Very good.
Tell us about what you do as far as a joint camp is concerned.
Typically, it's to educate the patient. It's primarily designed to have them understand the process from start to finish. We're with them essentially the entire time, but we like to meet with them as early as possible once we determine surgery is necessary to minimize their risk. It is to educate them about the risk factors that they might have, how we can minimize those, and collaboratively work with the surgeon and the primary care provider to do that.
Awesome, awesome. And we got to take a short break. Deb, we're going to get to you after the break, so stick around for more Wisconsin Doctors. We're talking about joint camp here at Mile Bluff Medical Center. Don't go away. Welcome back to Wisconsin Doctors. We're talking joint replacement and joint camp here at Mile Bluff Medical Center. And Deb Bieland, I want to make sure that you get a chance to talk about what your role is in the joint camp.
As pharmacists, my colleagues and I play an important role at joint camp. We meet with each patient prior to their joint surgery, and we take a medication history. This includes getting an accurate, up-to-date list of the medications that they're currently using at home, including the name of the med, the strength, and how they're using it. And then the history also includes any allergy information, if they've had allergies to medications or adverse reactions. We also talk to them about any experiences they've had with pain medications, whether positive or negative, ones that have worked well for them or ones that they haven't tolerated, to get a resource for the rest of the team to know what might work after surgery. And then a final, when we gather everything, then we update it on the electronic record so that it's available to the whole team.
Okay, so very important things in terms of getting ready for surgery. And let's talk a little bit about getting ready for surgery. So, Andrea, I'm going to start with you. After the primary care physician has referred a patient to have total joint replacement, they've gone through all the possible things that they, could do, the more conservative treatments, as you mentioned, Karen. What happens next after they get that referral?
Once they're referred to an ortho surgeon, the ortho surgeon will then obviously do his exam, take x-rays or review any x-rays or radiology studies in general to determine maybe further what's causing it and how to help it. Sometimes they do injections, but once it's determined they need a joint replacement, then they're set up for surgery. Once they're set up for surgery, about 2 weeks before surgery, they come in for this joint camp. And then within the 30 days of receiving surgery, they go back to see their primary care provider to discuss if they're optimized for surgery. Are they at lower risk for surgery? Have they done everything they can to have a safe outcome of surgery?
Right, right. And kind of stemming off of that, I want to turn to you for a second, Karen, as a physical therapist. Most people assume that if they're going to get total hip or total knee joint replacement, that they're going to need some kind of physical therapy afterwards. But you actually play a pretty vital role in getting the patient ready to have the surgery as well. So after the patient, goes through those steps that Andrea just talked about, what's the next step then?
Then my role is really to start the exercises, teaching exactly these 4. We start day 1, then we add a couple here on day 2. It's really education on this is what to expect. Here are the exercises. Oh, this one's hard for you. Well, Mike, you can't do this one. This is where the coach is going to help.
Right.
And here's how you help, because some people really don't know how to help somebody, don't know how to help somebody get in and out of bed when they need help. But it's that educational piece. We mentioned a little bit about where do we go from the acute care setting. What kind of chairs do you have at home? What chair are you going to sit in when you've had a new hip or a new knee? And or do you not have a good chair and we need to shop around and find one at a Goodwill store that will work for you?
Absolutely. And I like how you are educating not only the patient, but the patient's caregiver once they're released. I think that's important too. Mike, you are in charge of anesthesia and you will see the patient on surgery day, but you also meet with patients prior to the operation. What do you hope to accomplish when you meet with the patient in this way?
Well, there are multiple goals. One is taking the information that's already gathered, trying to tailor an anesthetic course that's very specific to the patient, using the medications that they're currently on, determining a course based on those medications, based on the needs for therapy, what their goals are at home, tailor that, answer their questions, make sure the care providers don't have any anxiety, and reduce that before they come.
Absolutely. And Deb, one last question. As one of the pharmacists, is there anything that you would like to see patients bring with them on the day of surgery?
Well, both to joint camp and on the day of surgery, it's very helpful if they bring a medication list. A lot of people are on multiple medications and the names are long and the doses are big and small numbers, and it's hard to keep track of all that. So if they bring an actual list or their even their medication bottles, that really helps us to make sure that the medication history is accurate.
We got to take a short break here, but when we come back, we're going to talk about the day of surgery and what happens then. Stick around. There's more Wisconsin Doctors coming up right here at Mile Bluff. Welcome back to Wisconsin Doctors. We've been talking about a very unique program called Joint Camp here at Mile Bluff Medical Center, designed to help prepare people for total hip or total knee replacement. And we've talked a lot about the preparation leading up to surgery day, but now we're going to talk about the day of surgery itself. Fun topic, right? So for Andrea, I'm going to start with you. What can a patient expect when they first walk in on the day of surgery?
Well, when they walk in, they're going to register at the front desk of the hospital, and then they're going to come back to the surgery department. A nurse will come and get the patient, take them back to their room. They're going to get changed into a gown, get their IV started, have a lot of questions to answer, like when's the last time you had anything to eat or drink, things like that. And basically get them ready for surgery, prepared for surgery, so Mike can do his part.
Yeah, absolutely. And then, Deb, you also have a role, or the pharmacy team has a role on the day of surgery. You or one of your teammates is going to be present for the patient the day of surgery. What do you do that day?
On the day of surgery, we again meet briefly with the patient prior to their procedure, and we're confirming their medications again to make sure nothing has changed since joint camp, and also to confirm when they had last doses, if they had things the night before, or there are some medications they're allowed to take the morning of surgery. So we confirm those things and then again update the electronic record so the rest of the team's aware.
So that's important because we want to make sure that any medication that the patient is taking prior to the surgery is not going to interfere with anything that they're going to get in terms of anesthesia, especially on the day of the surgery. Yeah. So, Mike, I understand that the patient is brought into the recovery room both before and just after the surgery. What's supposed to happen in the recovery room?
Well, we use the recovery room on the beginning end as a preliminary to set up the anesthetic. Oftentimes we're using regional anesthetics as a supplement to medication. We're really trying to minimize strong pain medications by using what we call a multimodal approach. Numerous medications, including blocks that are given to the patients prior to surgery to help the after surgery part that Karen deals with.
Right, okay. So it sounds to me like the anesthesia, you try to use anesthesia when you can in lieu of pain medication. That's very good. That's very good. Karen, so the patient usually spends 2 to 3 days in the acute care room after the surgery. And as the physical therapist, you're seeing the patient on a fairly regular basis. How often are you seeing the patient, and what exactly are you working on with them during that time?
So usually people with a joint replacement will see therapy twice a day. Sometimes the first day is 3 times. Physical therapy has the role of the first transfer, making sure it goes smoothly, making sure we follow hip precautions, knee replacements. We make sure that the joint, the block that Mike has talked about, really making sure that's working the way we want it to work. And if it's not working quite right, I go down the hall and knock on Mike's door and say, it's working really well.
Right.
Maybe it's a medication that is, the patient's a little sleepy and they can't quite participate at 8 in the morning. Then I come back at 11.
Right.
You know, so timing is a little bit involved there as well. But really it's a team approach. If the pain is not controlled, my job is much harder. So we make sure that that pain is controlled first.
Right.
Then we're getting them up and we are working on the exercises and the mobility. Get up, here's the walker, here's how, remember from joint camp, here's how we use one of these.
And you'll sometimes, correct me if I'm wrong, you'll sometimes get people up and walking the day, like right after their surgery, pretty much. I mean,
The sooner the better.
that's incredible. And so I think in that regard, I think it is important that the pain is controlled because you're not going to be really willing to walk on your knee if it's hurting. So that's fantastic. Very amazing things. We're going to take a short break, and when we come back, we're going to talk about what happens after surgery. Don't go away. There's more Wisconsin Doctors coming up right here at Bluff Medical Center. Welcome back to Wisconsin Doctors. We are talking total hip and total knee, total joint replacement here at Bluff Medical Center. And we've been talking a little bit about Joint Camp and how that's a very unique program that's designed to help people get ready for their surgery. So, Karen, before the break, we were discussing some things that you do with the patients when they are staying in the acute care room after the surgery. What do patients actually need to be able to do in order to be released from that acute care room?
Well, there's two big areas. Number one, I like to have people know a routine. Some of what they need to do depends on their discharge plan. If you're young, athletic, you want to go home, then we need to be able to walk to get at least a distance that you can get to the bathroom and back.
Right.
In and out of bed. Factors, is there somebody to help you get out of bed, or you got to be able to do it on your own?
Right.
If you're a younger person, spouses are working, so maybe you have to be able to manage for 6-8 hours on your own. But we like to establish that routine of mobility, exercise, rest. And just when you think you've done enough, you do it again. Mobility, exercise, rest. And really get a nice routine established, which coincides with pain management,
Right.
either medications or other options that we've tried. If they're going home, obviously stairs, getting in and out of a car. If somebody wants to go home, I want them to be able to walk quite a bit,
Sure.
at reasonable distance. Maybe the coach needs to know what they need to do to help
Right.
at home.
The coach being sort of their caretaker.
Their caretaker,
Yeah.
their friend, somebody that has lots of vacation time and can take a few days off to help for a day or two. Obviously, discharge planning is different if the option is rehab. Some people know I can't do it at home alone. So rehab for a week, maybe 2, so that they're up, they're moving, they're getting in and out of bed, they're going to the bathroom on their own. Things are smooth
Right.
at home.
Right.
A third option sometimes is you're able to go home, you can get up the stairs, but you don't want to do it twice a day.
Right.
So let's go home, let's have some home health.
Okay.
We have physical therapy come to the house 2 or 3 times a week. Occupational therapy comes to the house, learning how to cook and clean and do laundry again. Modifications to your home. Sometimes there's been some changes in their medications, so a nurse is checking on that. So they don't have to come back to see the doctor. They don't have to come back for their therapy
Right.
appointment, get in and out. So discharge planning is, and we always tell people, here's plan A, but let's
Yep.
have plan B as a backup just
Yeah.
in case.
It sounds like there's maybe a couple of different options. Did I hear a plan C in there?
There's a plan C,
Yeah.
yes.
Yeah. So make sure that we have options is important. Typically, if people are following their rehabilitation plan, whether it's going to a rehab center or occupational or physical therapy at home, how long typically is the recovery period before people are kind of back to where they were before they had joint problems?
Yeah. So lots of factors go into that.
Right.
Like I said, if you're an elderly person, you just want to get out to the mailbox and back.
Right.
If you're a young person who wants to get back to the golf course, then we got more work to do. So we start with those first couple weeks, pretty intensive therapy, and then things are moving well. We continue. The frequency of therapy drops down. I've had some people that are back on the golf course in 4 weeks.
Wow.
And then I've had some people that 6, 8 weeks, sometimes 10. A lot depends on their condition before surgery.
Sure, yeah.
If you put off surgery for 4 or 5 years and you've been walking with a real stiff knee or a stiff hip, you need a little more therapy.
Yeah.
But some of it depends on your patient goals. I had a gentleman yesterday, he says, when can I golf? I'm like, well, we got to get rid of the cane to golf, so we got another week. Let's
Right.
progress some exercises. So you work on this, next week I'm going to give you something harder, so make sure you got this established and this is good. This hip muscle is working really well, because then I'm going to give you a harder one.
Yeah.
You know,
So it sounds like you're willing to kind of work with the patients and what their individual goals are as well, which is
Absolutely.
kind of cool. Mike, you have contact, do you have contact with the patient at any point after the day of surgery?
Absolutely, we do. We're with them through the entire process. Preoperatively with the joint camp, reviewing chart, reviewing information, intraoperatively, postoperatively, we continue. We want to know that they're doing the things Karen is asking of them, the goals that they're trying to attain. We know that aggressive therapy early on makes better outcomes at 6 and 12 months. That's what this is all about.
Wow. And we just have a few seconds left, but this is open question for anybody. If somebody's considering a total hip or total knee replacement, why Mile Bluff?
You know, total joints can be done in many places. We believe here that we do it not just as well, we do it better. We have a collaborative approach from primary care to the surgeon to the team that's here to offer those patients something really particularly special, and we get great results.
This isn't the first time that you've sat next to each other in 6 months, in other words. You've had some contact prior to the show. Well, that's awesome. You've got a team approach here, and it sounds like the patients are very well cared for here at Mile Bluff. So thank you for having us here today, and I want to thank you for being on the show. It's great information. And I want to thank our viewers for watching as well. From all of us here at Wisconsin's 57 and Wisconsin Doctors, we invite you to live longer, live better. We'll see you next time.